I hope everybody can hear me okay. Can some of you hear me okay?
Yes.
Okay, very good. I'm so happy to be here and thank you everybody for joining us. I see that we have a large crew here. And I love Medicare and I think I'm a little bit of a nerd about it. So I get onto a conversation and almost a soapbox about it. And I'm going to try not to do that. My biggest challenge is to kind of stand within my parameters. And the complaint I had when I was selling was that I was always on the phone too long. And I felt like people didn't know enough. And I felt like we weren't supposed to tell them. So I thought, who's supposed to tell them? Well, that's what SHIP does. We're supposed to educate them and give everybody, whether you work with seniors or are a senior or going to be a senior, the right information and tools. So, for instance, whenever you need to call Medicare or Social Security about anything, note the date and time and the person you spoke with, because later, if something were to happen and you feel you were told incorrectly, you have proof of that. Otherwise, you might not have an appeal. So let's just get started. This is Medicare and Medicaid services that does SHIP. So we're going to be talking about Medicaid as well. Go ahead, next slide, please. Okay. There are 10 myths about Medicare. I'm going to go through these quickly. Medicare isn't free. Medicare costs you payroll taxes for 10 years. It's called quarters. You have to have 40 quarters in order to get Part A for no cost. That's not free. You already paid for it. Medicare Part B isn't free either. You have to pay, most people pay $148.50 a month to have Part B. And Medicare consists of A and B. We'll talk about that in a bit. Medicare doesn't cost the same for everyone either. Some people who are in a really low income bracket get their Part B paid for by the state, and then it's free for them. Other people who make a higher than average income have to pay something called IRMA. It's just an income adjusted higher premium. Medicare doesn't cover everything. It doesn't cover long-term care. It doesn't cover prescription drugs, and doesn't, as everyone knows from the news, dental and vision. So what we do is help people with options for those things that are designed to work with Medicare. And long-term care is specifically outside the realm of Medicare. So you have to get a separate plan for that. Medicare's costs and coverage change just about every year. Not coverage, no. Coverage is pretty much the same, except they've added over the years a lot of wellness and preventative services that might not cost anything. So a number of immunizations, a yearly wellness checkup, and cancer screenings, things like that. The costs do go up. Part B will plan. They plan on raising that Part B premium in January. The Part B deductible will go up in January, and the hospital. So they do tend to go up because inflation drives everything up. Myth 5, Medicare coverage is automatic when you turn 65. No, you have to enroll. If you're collecting Social Security, you will get enrolled into Part A, and you will receive a card in the mail asking if you would like to opt into Part B. If you're covered, say on your spouse's plan, there's no need to get Part B. But A, because it's no extra cost, you should go ahead and get it because it can act as a backup, secondary to your employer coverage. But we'll go into that a little bit more. But it's not automatic when you turn 65. And in fact, you can delay it. I can enroll in Medicare whenever I want. True for Part A, not true for B. B has enrollment periods. If you don't enroll within the 3 months following your birth month, when you turn 65, then you might need to wait, unless you've got employer coverage. I mean, there are all of these different qualifiers. So they do have enrollment periods for Part B. I can't qualify for Medicare because I have poor health. Absolutely not. Everybody age 65 and under 65 with a qualifying disability qualifies for Medicare. There's no health requirements involved. Myth 8, I can't get Medicare because I never worked or didn't work long enough. Yeah, you can, but it'll cost more. If you don't have the full 40 quarters, you need to call Social Security and they will look up your quarters, how many quarters you paid into the Medicare tax, and determine what your additional premium will be if you want to get Part A. Part B will be the same as everybody else. Medicare only covers people 65 years or old. We covered that before. Some people with disabilities get Medicare early. Usually it's 24 months after your Social Security disability payments start. And then Medicare and Medicaid are not basically the same. They're in fact two different things. Medicare is health care and Medicaid is assistance. Assistance is only for people who require assistance, either for health or for, income, financial reasons. But Medicaid is for financial reasons primarily. When your income is right about the poverty level, you could qualify to get your Medicaid, to have Medicaid pay for your Medicare Part B premiums and also the coinsurance in many cases. Next slide. All right, this is what your Medicare card looks like. It's got a number that's random, pretty random, very, very hard for fraudsters to get. Back in the day when it was your Social Security number, there was a lot of fraud because of, they would just find your Social Security number. Not that easy to find, but kind of easy. And then they would put an A on the end and they would most likely have your number. So Medicare changed the numbers several years ago. We still have a lot of fraud, about 2 billion or more last year. And they call and pretend to be Medicare. So one of the biggest things that we do in our outreach and getting the information out is that Medicare doesn't call. That's a whole lot easier to remember than don't give anybody your Medicare number. Because what if you need to give someone your number? When you call us, you need to give us your number, but they don't call. So it's not them if they're calling you. It's basically an 80-20 plan. Okay. These eligibility list here is what I was talking about for the qualifiers for people under 65. For instance, if you go on to dialysis, you will immediately be put on to Medicare. It's an 80-20 plan. It's the same for everyone. 80-20 is the Part B portion. The Part A has a deductible. If you go into the hospital, you'll get a bill if you're on original Medicare. There are plans that can help you with that, of course. And then no premium for the A if you have your 40 quarters in. Most people do. And then in Part B, there's a premium, and that premium for 2021 is $148.50 a month. And if you're collecting Social Security, it'll automatically get deducted. And if you're not, you arrange a payment plan with Social Security for how to pay for it. Next slide. Now, this is a little bit difficult to read. I gotta squint. You got two options for Medicare. One is original Medicare, consists of Part A and B, doesn't cover drugs. So step 2 of that left-hand column is you need to decide if you need to add drug coverage. My point of view is, yeah, you do, because there's a penalty not for not getting it. The Part D police won't come to your house and arrest you, but if you decide not to get it and then you want it later, that is when the penalty comes in. So if you have questions about that, I can definitely help you understand it. There's just something about insurance. They can make Part D affordable if they make it kind of a requirement for everybody. You know, not a law, but you know, if you think you want it later, get it because it's cheap. And then supplemental coverage is the third thing that comes with original Medicare. Helps you pay the 20%, the hospital deductible. There are supplemental plans that will pay almost everything after Medicare pays. They won't cover the drugs, which is why that drug step 2 is in there. Or you can choose an Advantage plan. This is a managed plan, like an HMO or PPO. It consists of or covers A, B, and D. When we say cover in the insurance world, we don't say pays everything. We say it's insurance for it. And so there's typically going to be co-payments for the things in the Advantage plans, although they will offer like a no Part B deductible, which is very nice. And they will offer like a zero copayment for your primary doctor. But if you have to go into the hospital or get an MRI or go to physical therapy or things like that, specialist, you will have to pay copayments with these plans. They will usually include a Part D coverage. You cannot get Part D outside of the Advantage plans in most cases. In Utah, you have to get your Part D built in with your Advantage plan or not get the Part D coverage. Probably about clear as mud at this point, maybe. Okay, next slide. All right, so Part A, there's a hospital deductible, $1,484. That's for this year. It is going up in January. It's not a deductible for a year though. They call it a benefit period. And when you get admitted to the hospital, that's when this charge goes on to your Medicare. You might have a plan that pays it or pays part of it or pays it differently, but it's for 1 day to 60 days. If you're in longer than 60, then you're going to get additional per day charges with Part A. A also covers skilled nursing. The first 20 days are included in that hospital deductible. And after 20 days, it'll cover up to 100 days, but you'll have co-payments per day in the skilled nursing facility. But other than that, Medicare will cover 100% of the first 20 days. Next. The Part B monthly premium for this year was $148.50. It will be going up to I don't know what it is, 154 something. The Part B deductible, okay, is 203. It is not for sure what these are going up to in January, but it's proposed it'll go up to 217. And then of course 20%, which that never changes. It's always 80-20 after the deductible. Lab services are no cost. And there's some other things that are no cost too when they are diagnostic. In other words, you haven't been diagnosed, so they want to make sure they catch it before it gets, you know, worse or bad or even existent. Next slide. Now, Part C, these are the Advantage plans. They're offered by private insurance companies. Okay, it's just a Medicare health plan where you choose to get the coverage from a private carrier. They have to provide all the services Medicare provides, but the insurance company provides them. To a lot of people, this is better. It's more local. They have somebody that they can call. They feel like they'll get better care. Sometimes people are against them, and that's why you get to choose. You can either be on Medicare or a Part C plan, but they have to cover everything as well or better than Medicare. And they're always better, and that's why they call them Advantage. Medicare acknowledges they're better. Medicare doesn't have a maximum out-of-pocket limit on its plan, but Medicare Advantage plans all do. That maximum out-of-pocket limit is the most you have to pay if you're in like a more serious medical situation and you end up accumulating a $100,000 bill or something, then the most you have to pay on any Medicare Advantage is $6,700. Medicare doesn't provide that. Your bill could be 20% of however high that bill goes. You know, it's one of the things agents use to, get people to choose a plan, but it really is true that Medicare doesn't have that, and all other insurance we know today does. Almost every insurance we know, except for some. The plan administers all of the benefits to the beneficiaries, and you complain to the plan if you have a complaint, appeal to the plan, and file agreements with the plan. Medicare, what they do is they oversee the plan, but they stay out of it. If you call Medicare to complain about your plan, they'll tell you to call your plan. It's sort of instead of Medicare, but you don't lose Medicare when you get an Advantage plan. And you have to pay your Part B premium. But on the Advantage plans, many of them don't cost any additional money. They have a zero premium as long as you pay your Part B and you're in A and B. In Utah, the plans generally include prescription drug coverage, and the people who get a plan without prescription drug coverage have it from somewhere else, like the VA. All right, next slide. All right, so HMO and PPO, you're probably familiar with these terms, that these are the same kinds of terms that employer plans use. A PPO allows you to go to doctors and specialists outside of the network of the plan, and they will typically cost more because they have that additional coverage and they're more flexible. The people that want to save the most money get an HMO. Then there's a third kind of plan called a special needs plan. They're available for people with certain medical conditions and primarily people who have Medicare and Medicaid, called a dual special needs plan. And this year we have 6 of them, and last year we only had 2, and they didn't have very high star ratings from Medicare. Now for 2022, we have much, much better options for people with Medicaid. Next slide. And then the Part D is the drug-only coverage. Some people just have original Medicare and a Part D plan. If you're on Medicaid, that works because Medicaid's picking up those co-payments. But Part D by itself with just original Medicare might not be such a good idea. Medicare contracts with these carriers, much as they do with the Part C. You have to have an enrollment period to enroll into one. You complain or file a grievance or appeal to the plan, okay, and they all have a premium. Okay, you have to pay either your Part B, you have to be enrolled in either Part B or Part A. So this statement about continuing to pay your Part B premium isn't necessarily true. Some people have Part A and they don't have Part B and they have a drug plan. And while they're working on getting their Part B. In Utah, for 2022, the least expensive plan is $6.90 a month. So they really are affordable. Next slide. Okay, so there's a little picture of Einstein. Next slide. All right, so this is the definition or explanation of the donut hole. Now, these are 2021 figures, and they will change for 2022. For instance, the deductible will go up. You need to look at this chart from the bottom up. Okay, so first there's a $435 deductible. I think it'll go up to $450. I'm not exactly sure. Not all plans require the deductible on all drugs. Most plans waive it for generics. And not only that, but generics are a lot less expensive and you might not probably won't reach the donut hole if all your drugs are generic. Once you meet the deductible, or if you don't have one, this says 25%, that's your share of the cost, and Medicare's is 75%, but actually, this is actually adjusted by the plans. They will usually have a co-payment instead of a co-insurance. The worst drug plans have the 25-75, just saying. A lot of times they'll have a zero co-payment for your Tier 1 generics. you know, $2 or maybe $20 for a tier 2 generic. And then your brand drugs will be somewhere between about 49 copayment for a month's supply and 100. They vary, but they are typically less than this third level, where it says the brand name, the Medicare pays 75%. Generics, actually now Medicare pays 75% on those too. And it's worse for some people, but it's not worse for others, and not as bad as it used to be. When Part D came out in 2005, you had to pay everything in the donut hole. There was no coverage. And that's why it was referred to as the donut hole. You're eating away at your donut, and then you come to the hole, no donut. You get past the hole, and there's donut again. And that's this fourth one. The it doesn't say it on here, but it's the catastrophic period at $8,140, and it's a little bit different now. Your co-payment goes down to 5%. So once you pay that 8,000 something, and you're really into your medications with some skin in the game, then you get to go down and pay only 5% through the end of the year, and then starting in January, everything starts all over again with the deductible. Next slide. And by the way, that information about the drug coverage is very confusing and complicated, and that's the one thing people have the most trouble with Medicare. This table shows all the supplement plans. There are 10 of them: A, B, C, D, F, G, K, L, M, and N. You can see by the check marks which of the things after Medicare pays that these different plans pay. The ones you want to really pay close attention to are the Part A costs, okay, and the Part A deductibles, because those are the things that cost the most. Skilled nursing copayments are very high after 20 days. So you can look down this and see that F has everything checked. F, the 100% plan, the only plan that covers 100%. G is almost there, second best. It only doesn't cover the Part B deductible. People born in 1955 or later cannot get an F plan. And people born before 1955 should probably change to a G if they can, because now that F plan is getting very unaffordable for a lot of people. And you end up paying a lot more than for a G. And look, there's only one difference: $203 a year Part B deductible. The K and L plans are very good for people who want to supplement but really have a limited budget. They are an alternative to a Medicare Advantage plan. And in fact, when I was an agent, I sold a lot of K and L plans to the people who just wanted the idea of the supplement, and they liked that better. They didn't want managed care. A lot of trouble with Medicare Advantage. For one, you might have 5 different doctors and might not have one plan that takes them all. So this is a good alternative to that if you can get one. Next slide. Before I continue with Medicaid, I want to say one more thing. I said if you can get one, because supplemental plans are different from the insurance that we know today. With Medicare, with a Medicare Advantage, with a Medicare Part D plan, with a marketplace plan, and an employer plan, you don't have medical underwriting. They can't turn you down for health reasons. Not the case with Medicare Supplement or Medigap. They're secondary insurance. They do not have to abide by that rule, so they don't. If you're at high risk, they will decline you. If you want a Medigap, you're best off starting out with one when you age into Medicare, or at least while you're healthy. You know, if you get sick and then try to get a Medigap, you might not be able to. So that's just an important thing to say, because I tell everybody that's aging into Medicare about Medigaps, even if they call me and tell me they want an Advantage plan, because you might not be able to get one later. Now we're going to talk about Medicaid. Medicaid is health insurance for people with limited income and resources. It's available for people of every age. Many of the people that we know that are not on Medicare are on Medicaid as their primary insurance. These are the income limits for 2021. They will be changing. Um, and when you reach Medicare, whether you age in or whether you get on Medicare because of a disability, your Medicaid changes to secondary. So when you don't have Medicare, it's your primary insurance. These are the information about it, whether or not you have Medicare. But when you have Medicare, it becomes secondary, and they call it the Medicare Savings Program, just to distinguish it from regular Medicaid. Same rules apply. Next slide. We're about done. Okay, so these are the different levels of the Medicare Savings Program. QMB is the highest. That one will pay for, see on the bottom, pays in the last of the 4 bullets, pays Medicare deductibles and coinsurance. The others don't. So this QMB and the SLMB and the QI pay the Part B premium, okay? But they don't all pay the 20% and the hospital deductibles. If your income is not quite low enough to qualify for QMB, they'll put you in SLMB. It has some higher income and asset limits. This is also asset limits. So if your savings is higher than 11,960, and that number's gone up too, then you won't qualify for any of the Medicare savings programs because you have assets. Next slide. All right, we talk a lot about healthcare fraud. As I mentioned, Medicare doesn't call you, Social Security doesn't either. The power company doesn't call you to tell you that your bill is late. These are all fraudulent calls. In the case of Medicare, they're fishing for your number to commit uh, um, the fraud from false claims. We recommend people read their statements that you get every 3 months from Medicare to make sure that all of those things that they're charging Medicare and you are things that you actually received. They can get your Medicare number by overhearing it in a doctor's office, stealing your wallet, or calling you and pretending to be Medicare. I have a client over there at the Draper Senior Center that every single month he asks me when we're going to start making a plastic card, because he keeps getting calls from people claiming to be from Medicare saying that they want to send him a plastic card. All they really want is his number. So they say, okay, just give us your number. We'll send you the new card. Looks just like a Medicare card and it's fake. Now they have his number. Now they can file false claims. So it's about protecting your number, just like a credit card number, not giving it out. And also by not speaking it out loud. Also by knowing the people that you're giving it to. Okay, and there are always people, should be people you called, not people that called you. Checking your summary notices, like I said, and reporting it. You can report your lost or stolen or somebody compromising your Medicare number by calling us here at SHIP. Next slide. I think we might be done. That's it. So there's our number. That is the actually Aging and Adult Services outreach number. They will get you over to a SHIP if they can't help you. They can answer a lot of your questions as well. And they've been very, very helpful to us this open enrollment season. And now we're going to open it up for some questions and answers.
So if you have a question, you can unmute yourself or you can put it in the chat. Here we go. We have one question for you, Sherry. Do I enroll into Medicare during the year that I turn 65? even though I'll still be working and will carry health insurance?
That's a great question. You should, okay, there's one caveat to that, and that's if you have a high deductible plan at your work. So I'm going to first address a regular non-high deductible plan. If you like your employer coverage and you feel it's a fair and reasonable premium, you can delay Part B and not enroll into it. And save yourself and your spouse $148.50 a month. Usually those employer plans cost less than that and give you good, decent, adequate coverage, and even many times better drug coverage than Part D. So with that said, you should apply and enroll into Part A anyway, because you probably have your 40 quarters, and that way it won't be a cost to you. And when you have Part A, Medicare, Part A acts as a secondary insurance. If you have an HSA, do not enroll into Part A. Just keep your HSA in your high deductible plan. As long as you're not collecting Social Security or your spouse isn't collecting Social Security, you'll be just fine on your employer plan. What happens with an HSA is the IRS will tax you 10% if you have an HSA and Medicare. And then Medicare, when you enroll into Part A, will backdate your Part A 6 months. So you got to stop contributing to an HSA 6 months before you apply for Medicare Part A and or B when you're getting ready to retire.
Does that work if, let's say, my spouse is older than I am and turns 65 before I do? Does that apply individually or as couples?
Well, the rule is that the person on Medicare can't be contributing to the HSA. So you might have an HSA for both of you, and you might be contributing. You cannot contribute her portion without the tax consequence.
Thank you.
It gets a little complicated. If you have an HSA and you have these questions, you should talk to me. Okay, so I can barely hear you, but if you can hear me, that's good.
Yes. Yeah, just
Okay.
keep talking.
So those plans on that table I showed you are some of them are available from PEHP. The F plan, if you were born before 1955, and the G plan, if you were born in or after 1955. Then you are also eligible for a K or an L. And those are the two I said pays 50% or 75% of the 20. So it gets a little complicated, but you'll be able to see from that table. Now that table, we can send out these slides to you, and we can, I'm not sure how we arrange that, but also the table is available by Googling Medigap table. And you'll see about 100 of them. They're all the same because those plans are all standardized. The thing about the PEHP retirement program is you don't have as many options for Part D with PEHP. And I've seen some people having a problem with that. When you're on a retirement program with the county or the state, and you have the PEHP Medigap, then you must also get the other plans, the dental and the drug coverage. And so it's sometimes not the best idea, but usually people are happiest doing that. And oftentimes your employer will be paying part of that, at least for some time.
Just thank you, Sherry. Just to answer a few of the questions here, the recording, once it's, edited and everything will be posted on the YouTube channel. So if you need a recording of this, you're welcome to go to the YouTube channel to get it. And I probably need a little direction on how we get people those slides. Erica, do you have direction for that?
I don't, unless they wanna send me their email in the chat privately, just to Erica Thompson. Send me your email there, and I can forward the slides to you. That's the only way I can think we can do it.
Okay. And then, okay,
Okay.
Sherry, the next one is, are you ready? It says, when I claimed my husband's SS, they enrolled me in Part A without telling me, and I have HSA for this year.
That is because when you're collecting Social Security, you must be enrolled into Part A. That's their law. I can't, nothing can change that. And it is a problem for people with an HSA.
All right.
And the only,
Oh,
and
go ahead,
I
Sherry.
don't know that there's anything that you can do about it now. I wish they had told you. They don't always ask, well, do you have an HSA? You know, that's the thing. They don't always ask those questions, but I've seen a number of people getting into trouble with that. They will charge you 10% for the time that you had an HSA and Part A. So the most important thing I can tell you to do is don't contribute. You can have it. You cannot be contributing to it.
All right, so we have the next question is, if my previous employer provides retiree medical, including an HSA, and I am 65 on Medicare A and covered under my spouse's plan, is that a problem?
What you need to be doing is anybody that's on or planning to be on Medicare needs to not contribute to the HSA. Your spouse can contribute to it because it's designated whose contributions those are on the HSA. It's a government qualified plan. It's a document that requires certain legal requirements, like whose contributions are these? Are these the employee or the spouse? If they're yours, that's when the tax consequence comes in.
Thank you, Sherry. The next one, it says, so F is before 1955 and G is after?
Correct.
All right, these are like, it's impressive that you know what these questions are. That's excellent. Oh, what is an HSA?
Okay, when you have a high deductible insurance plan through your work, they usually will contribute. They'll open a health savings account and contribute funds into it from your employer for no cost to you, as part of being enrolled into the high deductible plan. They also allow you to contribute. So the HSA is only available with a high deductible plan.
It's kind of a perk to working at a larger corporation sometimes, having that HSA. It seems like.
You know, I've seen it a lot. More and more people are working past 65. 70 is like the new 65. And they're waiting till 70 to collect their Social Security, and they're continuing to work, and they still feel young. And a lot of them are in high deductible plans. They have good health. They don't see why they should be in a more expensive insurance plan. And in the meantime, they can continue to accumulate the health savings account, which is still theirs, into retirement. I know a guy whose health savings account is $60,000, and he's hardly used any of it.
Yeah, it is. It's interesting how so much of the older adults, just the view of it is changing because we are becoming just healthier as we age. Any other questions of anybody? Anybody have another question? I think I covered them all. Of course, you can unmute yourself if you have a question. And Sherry, would you mind telling us what SHIP is?
SHIP, yes. You know, I have a new deck of slides that has that in there, and you got the old one. SHIP stands for State Health Insurance Program, but actually it's State Health Insurance Assistance Program, because Medicare recognizes the need to have somebody to talk to that's completely unbiased and just there for the people, not there for themselves. And so they fund us. We get our grant money from them. It's from their fraud department, from their Medicare and Medicaid department, and from their general information department. And so what that does is that pays my salary, and I don't get anything from any insurance company, which means that every piece of information I give is just absolutely free and absolutely unbiased. No, I don't have any care in the world about whether you get enrolled in anything or or how long I helped you or anything. And that's what you get when you call a SHIP coordinator or counselor.
Thank you, Sherry. That is such a wonderful perk to Salt Lake County. And hopefully everybody's aware of, again, what Sherry just said, is she actually is there to help you. She has no ulterior motive. So if somebody approaches you about Medicare that isn't from that SHIP program, they probably have some motive to get you to go a certain way, where Sherry wants you to get the thing that suits you best. That's her motivation. So there's Sherry's number. Yes, it is being recorded. Not her number, this presentation, but you're welcome to call Sherry, I'm assuming, because she put her number in the chat there. So please jot that down. And any other questions, comments?